Welcome. I am Terry Tropin, and today I'll be discussing ICD-10 diagnosis and procedure coding for COVID-19. The guidelines for COVID change frequently. This video discusses the latest coding guidelines. These guidelines are from ICD-10-CM book and also from information published by AHIMA and the AMA. First, let me tell you a little bit about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certification. I am also an AHIMA approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These were developed as part of my teaching. I thought the coding guidelines were confusing, so I started doing study guides, and then I went on to doing full-fledged books. These are my books: Evaluation and Management Coding Made Easy, ICD-10-CM Coding Made Easy, and ICD-10-PCS Coding Made Easy. These are on Amazon and updated every year or as needed. So here's an overview of what I'm going to talk about in this video. I'm going to talk about coding for confirmed and suspected COVID-19 sequencing guidelines, COVID-19 and other conditions, COVID-19 and MIS are very specific guidelines for this, complications of vaccinations, post-COVID-19 Z codes, and ICD-10 PCS coding. Okay, so first let's look at the guidelines. Now, the most confusing part right off is that the actual codes for COVID-19 are in Chapter 22, Codes for Special Services. But the guidelines are in the infection section, which are in Chapter 1. So right away, this makes it confusing. And also, this Chapter 22, the U codes are not alphabetical. They're after the Z codes in your CM book. So first of all, the guidelines state that COVID-19 is coded using U07.1. It's only used in confirmed cases. Now, what does confirmed mean? Confirmed means the provider documented the patient has COVID-19 or a positive COVID test. There's no documentation from CDC needed in order to say it's confirmed. Note that this is an exception to the inpatient guidelines about confirmed or suspected conditions. The guidelines state that a diagnosis of suspected or probable condition is coded as confirmed in the inpatient setting. This is an exception to that rule. You only code this if it's confirmed. Note that this is the same exception that's used for HIV coding. You don't want to say that a patient has HIV or COVID when they don't. A patient may be asymptomatic and still test positive for COVID-19. In this case, code it as COVID, confirmed COVID, U07.1. Although the individual is asymptomatic, they've tested positive, and therefore they're a U07.1. Now, what if a patient has signs and symptoms but no confirmed final diagnosis of COVID-19? In this case, as we said, do not use U07.1. It may be documented as suspected, possible, probable, inconclusive, whatever. Don't use U07.1. Instead, use the appropriate code for the signs and symptoms that are manifest. R05.1, R05.9 for a cough, R06.02, shortness of breath, R50.9, fever. These are some of the possible signs and symptoms that you might get. There may be others. If the patient also had actual or suspected contact with or exposure to someone who had COVID-19, code also Z20.822. And we're going to talk more about the Z codes later on. So it's a lot of guidelines about sequencing. So when COVID-19 meets the definition of principal diagnosis, list first U07.1, followed by the appropriate codes for associated manifestations. So meets the definition of principal diagnosis. What does that mean? Well, it means the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. Principal diagnosis. Now, of course, as is often the case, there's a rule and then there are exceptions to the rule. The exceptions to this rule about sequencing are obstetrics patients, newborn patients, and lung transplant patients. So let me talk a little about those. For a pregnant patient with COVID-19, sequencing depends on the reason for the admission. If the reason the patient is being admitted is COVID-19, list first O98.5 with additional digits, then U07.1, and then any manifestation. If, on the other hand, the reason for admission is a condition unrelated to COVID, but the patient tests positive, list first the reason for admission, then O98.5 with additional digits, and U07.1, and codes for manifestation. Note that none of these examples list U07.1 first. Okay, COVID and newborns. Sequencing depends on when the patient, the newborn, contracted the infection, if known. If there's no indication whether an infection occurred in utero or during the birth process, code U07.1 and then codes for manifestations. If it's documented the newborn was infected while in utero, code first P35.8, other congenital viral diseases, and then U07.1. If documented as the newborn infected during the birth process while they were being born, list first Z38, live-born infant according to place of birth and type of delivery, which is always first on newborn charts, then P35.8 and U07.1. Okay, so those are the only ones where you have where the COVID may not be listed first, but there also are specific guidelines for certain conditions. One of those is lung transplant. The guidelines talk about COVID-19 infection of a patient who has a lung transplant. First code T86.812, lung transplant infection, and then U07.1. So the transplant complication is listed first. There's also specific guidelines that mention sepsis. Now, as you know, severe sepsis is never ever listed first, but if there's a COVID-19 infection that progresses to sepsis, code first U07.1, and then either a code for the infection or a code for severe sepsis, whichever is appropriate. So if the patient has confirmed COVID-19, U07.1, they may also have symptoms such as cough, fever, shortness of breath, etc. These symptoms are usually not reported separately because they're expected with COVID. They're related to COVID. So you're not going to do a separate code for those. However, there are specific guidelines for some conditions: viral pneumonia, acute bronchitis, and lower respiratory infection, NOS. So let's look at each one of those. For a patient with COVID-19 and viral pneumonia, both conditions are listed. A note under this code states that U07.1 is listed first. So you have two codes, this one and this one. So for COVID-19 and bronchitis, the U07 code is listed first, and then the appropriate code for bronchitis. So you're going to list first this one, and then if it's acute bronchitis, J20.8. If it's not specified as acute or chronic, you do the UO7.1 first and then a J40. So also guidelines for lower respiratory infection. If the infection is not specified as acute, use J22. Unspecified acute lower respiratory or acute NOS. Again, UO7.1 is listed first. Now it's other specified. UO7.1 is listed first, and then J98.8 for respiratory infections not specified as acute, or not specified as lower respiratory infection, not specified as acute. So this is respiratory infection NOS, so it's not, we don't know if it's lower, we don't know if it's acute, so you're going to use the J98.8 code. Okay, COVID and acute respiratory distress syndrome. In this case, again, UO7.1 first and then J80. So sometimes there'll be a manifestation, a patient will have COVID-19 and then have manifestations that are not respiratory related. And here's some examples you can see in what I have here: neurological, renal, gastrointestinal, cardiac, etc. So the guidelines say, list code for condition, the manifestation is listed second, and first is UO7.1. So the real question in here is, should it be reported separately or not? If it's non-respiratory, definitely. If it's respiratory, look at that list that gives you conditions. And is it a symptom or is it an actual condition? That's what the difference is. Okay, COVID-19 and multisystem inflammatory syndrome. This is discussed specifically in the guidelines. So what is this? This is a rare but serious condition associated with COVID-19. Different body parts become inflamed. It could be the heart, the lungs, the kidney, the brain, the skin, the eyes, or gastrointestinal organs. At first it was found just in children, but now they're saying that it's children or adults. So guidelines say, wait a minute, if the patient has both MIS and a current COVID-19 infection, list first UO7.1 and then the code for the MIS, M35.81. If the patient has MIS and a history of COVID, list the MIS first and then UO9.9. And we're going to talk more about that code. That's long-term COVID, and we're going to talk more about that later. Okay, so a patient develops MIS having known or suspected exposure, but no current infection and no history. So, been exposed, but don't have a diagnosis, confirmed diagnosis, and no history. Code first the M35.81 and then Z20.822, exposure. Okay, so as we know, sometimes patients develop complications of the vaccinations. I know we all felt a little tired and arm was sore, but this is complications that require treatment, monitoring, or treatment of side effects, okay? So first you assign a code for the side effect, such as fever, followed by T50.B95A, adverse effect of viral vaccines. So sometimes the patient will have an allergic reaction to the vaccination. In this case, list first Z78.49XA, other allergy initial encounter. And then you're going to code the codes for the symptoms. Now sometimes it's going to progressively more problematic conditions, a patient may have an anaphylactic reaction to the COVID-19 vaccine. So in this case, you do T80.52XA, anaphylactic reaction due to vaccination. Now, you may say, well, wait, T80.5 says anaphylactic reaction to serum, which this is not. The vaccine is not serum, but this is the closest available code to capture this condition. This has been stated this way by the AMA, which means we'll probably get a new code for it at some point. Okay, so the patient has COVID, they were treated, but they may have post-COVID-19 conditions. So post-COVID-19 is also called long COVID or long haul COVID. So what is this? Well, this includes problems that can last for a long time, often weeks or months. The symptoms can be fatigue, loss of smell or taste, or more serious conditions such as chronic respiratory failure. So this is coded as U09.9, post-COVID condition unspecified. And I will bet you that next year there will be more specific codes under the U09 section. Okay, so the patient has a sequelae of COVID-19 or associated symptoms or condition that develop after COVID-19 infection. So this is what happens. Let's first decode for the specific symptoms or conditions related to the previous COVID-19 infection, if known, and then code U09.9. Don't use U09.9 to indicate a current COVID infection. So a patient with long COVID, sequelae of COVID, is U09.9. However, the guidelines specifically state U09.9 is not assigned for patients with manifestations of a current COVID infection. And it also states, don't report personal history of other infections with U09.9 if any COVID-related manifestations are present. So remember, the history codes mean over-cured, no symptoms, nothing. So you're not going to use that personal history of code with U09.9 because obviously there's some kind of symptom manifestation, sequelae, something still going on. So, in the unfortunate instance, when a patient has a condition associated with a previous COVID-19 infection and then develops a new one, very sad circumstance. So they had a previous one and now they have a new infection. You can use U09.9 and U07.1. Code also the specific conditions associated with the previous COVID-19 and also any conditions related to the current COVID-19. So any signs or symptoms that are there or conditions that are there due to either the previous one or the current one can be reported. Okay, so this is important. I kind of went around and around with this because the guidelines are kind of confusing. So Z codes, the American Hospital Association published a new clarification for using ICD-10 codes for COVID-19. So this states that Z20 codes, contact with or suspected exposure to communicable diseases, are not used only for patients who have been exposed to COVID, but also to individuals in an area in which COVID is present. So that tells you, so it's not just use a screening code, you're going to use the Z20 code because we are unfortunately in areas that are epidemic throughout the country. Okay, so let's look at testing. Contact with and suspected exposure to COVID, Z20.822. If the infection is ruled out, the test is inconclusive, or they say unknown results, Z20.828. Okay. Preoperative screening is Z01.812, and then either Z20.828 or Z20.822. If the patient had symptoms but no confirmed diagnosis of COVID, Don't use these list of symptoms. Okay, so in the good circumstance where the patient is considered cured, no signs or symptoms, use Z09. You can also report with that a history, personal history of infectious and parasitic diseases, Z86.16. So let's look a little more closely at Z86.16. Personal history of other infectious and parasitic diseases, history of COVID. If the patient is seen for a follow-up visit after COVID has resolved, no symptoms, they will get tested again. If the test is negative, do Z09 and Z86.16, follow-up exam and personal history. On the other hand, if they test positive, use the U09.9 because it has come back or it is still there. Okay, antibody testing. The code for antibody testing is Z01.84, encounter for antibody response examination. Now the guidelines say do not use this code if testing was performed to confirm a current COVID-19 infection or testing was a follow-up test after resolution of COVID-19. So this is only when the patient is seen specifically for antibody testing, but they don't have a suspected COVID or anything like that. So this is very specific as to when you can use this. Also, this was in a notes guideline changes. There's a code you may be aware of, Z28.3, under immunization status. Don't use these for a patient who has not been immunized against COVID. Don't use it. Immunization safety. Z71.85 is encounter for immunization safety counseling. This is used for patients who want to discuss whether or not they should get the COVID vaccine, have some questions specific to this. It's not for the general kind of questions right before you get the vaccination. So this is for an encounter basically for immunization safety. The patient needs some reassurance that this is going to be okay. Okay, now we can move on to ICD-10 PCS coding for COVID. There are codes for vaccinations and for introduction of therapeutic substances. We'll start with vaccinations. For vaccinations, refer to table XW0, new technology, anatomical regions, introduction. The vaccine may be into subcutaneous tissue or into muscle, both percutaneous. And you see have dose 1, dose 2, and then vaccine. Dose 1, dose 2, vaccine. So I guess for the booster shot, you would do that one or that one. So also in XW0, you have injection into a peripheral vein, percutaneous, and into a central vein, percutaneous. And these are specific drugs, specific codes for specific drugs. This is a new technology, remdesivir, sarilumab, tocilizumab. Anyway, for these, and also there's an other new technology substance code. So for the medications, the drugs that they've used to treat, they have these, and then if something else is being used, use this one. These are only for COVID. Okay, we also have sometimes drugs introduced in other ways. The previous ones were percutaneous. This is mouth and pharynx with an external approach. And it's just other new technology substance, and subcutaneous, percutaneous, other new technology substance. Okay, we also have codes for transfusions. These are in table XW1. These include transfusion of hyperhidroxyurea hyperimmune globulin, and high-dose immune globulin. So this is the use of plasma from recovered patients to treat current patients, okay? So XW1, new technology, transfusion, you have plasma, convalescent, high-dose intravenous immune globulin, and hyperimmune globulin. And then you also have those same ones except in the central vein, percutaneous, plasma, high-dose, hyperimmune globulin. So there's a test for COVID that requires 3 PCS codes. This is the ischemia care, respiratory, and stroke test. This test uses blood and nasopharyngeal fluid to determine whether a patient has COVID. All of these codes all these tests are coded in the new technology section, and we have XXE5XT7 for mRNA, XXE5XB7 for antibodies, XXE97U7 for chain reaction on the nasopharyngeal fluid. So this one test requires 3 codes because it has 3 parts. Okay, this is a lot, and particularly since they keep changing all the time. So here's what we have. Here's what I suggest you write into your book. UO 7.1, there's some tips under that, so circle those. UO 9.9, circle the note under that too. In the guidelines, circle COVID-19 guidelines. So in the guidelines for the infection section, chapter 1, circle those guidelines. And here's kind of the Z codes are kind of confusing, so you can write this in somewhere to keep them straight. Screening for COVID, Z2822. Rule out tests and known inconclusive, Z20.828. You can write these next to the codes. Preoperative screening, Z01.812, then either Z2828 or Z2822, depending on the circumstances. Patient is cured, you have Z09. They have a history, it's Z86.16. And if they're for antibody testing, you have Z01.84. So a lot of different codes. So in your PCS book, I would say go into the index and write in COVID, okay? And next to that, where it would be alphabetically if it was there. And then say see tables XW0, XW1, and that'll get you right where you want to go, regardless of what the medication is. You could also write in the care, respiratory, and stroke test, requires 3 codes, and write in the codes. That completes this video. If you have questions or comments, please feel free to contact me. If you enjoyed this video, please give it a like and a subscribe by clicking on the picture in the lower right-hand corner. Here are the books I have written on coding. So all of these have now been updated to 2022. And they're updated every year. And if there are changes in the spring, which there have been the last couple of years, I update the books again. So the easiest way to find them, you can go on to Amazon Books and type in my name, or you can look at the introduction to this video and it gives you the link to the books on Amazon. Thank you so much for listening. I hope to have more lessons up soon. My next one's going to be COVID CPT coding. Thank you.